Marcia here. I love sharing products and information that can really be life-changing. And today we're going to focus on spinal bracing because most people are not aware of how active spinal bracing can be a wonderful adjunct to treatment and really make a big difference in people's lives. And I'm excited about our two special guests today. We have Dr. Mike Studer, who's been a physical therapist since 1991. He's board certified in neurologic physical therapy. He is an international speaker and the co-founder and co-owner of Spark Rehabilitation and Wellness in Bend, Oregon. He's an adjunct professor at Touro University, and Dr. Studer has authored over 40 articles, 7 book chapters, and he's the author of the most recent book, The Brain That Chooses Itself, a practical applications-based guide to increasing both health span and lifespan. He has extensive experience and knowledge on spinal bracing. And our second guest is Ed Wilbourne, who has 33 years working with orthopedic and post-surgical rehab and bracing. And during this period, he's launched new companies and product lines. But the one he's the most proud of was the launch of the Spinomed. In 2003, the Spinomed was a brand new concept for the U.S. market. It has since become the gold standard for the dynamic orthosis segment for spine bracing products and is driven by patient success and multiple published studies. And the reason I wanted both Ed and Mike here was to really share what is possible and who this can be, really make a difference for and change their lives. So before we get started, what I want to do, I just want to show you a picture of this brace. And if you are just listening to this podcast, you can go back to one of the platforms that has, and watch the video. But let me just get that for you. So this is the Spinomed brace, and I just wanted you to see what it looks like so people are active while they're in it. And, just take a look at it because this is what we're going to be talking about. So this interview is full of lots of great information, so stay tuned. Welcome, Ed and Mike. I am so happy to have you here. This is such an important topic and one that most people aren't familiar with. And I love sharing resources. I love sharing things that are really going to make a difference in people's lives. And, this brace is something so special and can help so many people. So I'm really, really excited to have you both here. So welcome.
Well, thank you.
Glad to be here.
All right, we're going to start with you, Mike. Mike, as an expert in motor learning and health span lifespan, can you tell us how the Spinomed can help people both maintain and gain strength as a function of being more well-aligned?
Margie, that is an excellent question to start off with, and I'm very pleased that you asked that one. If we understand about the experience of the brain and the body interconnecting, we do know that when the brain is negatively reinforced through painful experiences, the brain won't attempt to recruit muscles appropriately. It will actually cause the individual to become less active, cause cortisol to increase, and cause our dopamine or pleasurable experiences to decrease. So when we think about all of those things, pain inhibits me from moving, pain inhibits me from recruiting powerfully, and pain inhibits me from experiencing pleasure. All of those things also increase stress, i.e., cortisol and inflammation. So now let's use the reverse of those if we were to remove the element of the negative reinforcer, in this situation being pain. All right, if we can include an individual being more well aligned and less painful, now the brain gets all of those opportunities. It gets the opportunity to recruit muscles powerfully, feels confident in creating some neuromuscular recruitment across the entire body of a muscle and more than one muscle, causes the individual to feel as though they can become more active throughout the day. So participation increases. Now, what do we get? When people participate in the activities that they enjoy, they prefer, and they choose, now they get dopaminergic experiences rather than cortisol experiences. Inflammation comes down, learning goes up, depression goes down, and we get all of those opportunities, which now reinforces me to continue to be an active person. I want to use my muscles. How strong can I use my muscles? I want to be more active. Yes, let's go do, let's go play, etc. All of those things are a positive cycle rather than the reverse, a negative cycle.
That's really unbelievable because most people don't even know they might be out of alignment. And most people aren't really walking around even thinking about alignment, but yet how powerful it is and how so many positive changes can occur when we are
Yeah.
in alignment. All right, Mike.
Yeah.
So something else you've written about that really pertains to our conversation is about fear. You've been an invited speaker on fear, and you speak about this a lot. And can you help us explain why it's so pervasive and how the approach we're discussing with using bracing can help reduce fear and so many of the secondary effects of fear, which we know are just so negative?
Yes, Margie, that's an excellent follow-up. Very intelligent, considering what we just talked about was poor alignment and the negative reinforcer of pain. Well, what's one of the main causes for us to experience fear? We can have fear, it's an omnipresent symptom, but pain is one of those things that can actually cause fear. What are the other things that cause individuals that are your listeners to be fearful? Well, you can be fearful of being incontinent. Well, with poor alignment and poor mobility, your likelihood of being incontinent is going to increase. Your ability to expediently make it safely to a restroom is going to be suppressed. Now, you're also going to find that a number of your listeners are going to be fearful about the stigma of aging. What do we associate with aging? Well, I'm going to be slow. I'm going to fall a lot. I'm going to be in pain, and my alignment or my posture is going to be poor. That's a lot to be fearful about, and we can do something about that. What are some of the other omnipresent figures of fear? Well, people can be fearful of falling. People can be fearful of becoming frail, and the list can go on and on and on. So, as a very primitive experience of the human brain, it's natural for us to be watchful for negative things to come. But what you and I share, and what I've heard resounding throughout your podcast, is we want to look for joy, we want to look for opportunities, and we don't want to be burdened by fear. So, in fact, to answer your question, what we're looking for is an opportunity to help people see hope as the four-letter word that can beat fear, that other four-letter word, and pain. So, what we're looking for is giving people an opportunity to say, now you expected to have pain, but it didn't happen. You expected to lose your balance, but it didn't happen. You expect that you'll be leaning forward and people will tell you to stand up straighter, but it's not happening. And so, Margie, that's something that's very powerful in psychology known as the reward prediction error. If you expect something negative to happen, but it doesn't happen, that actually gives you a rush of dopamine because you predicted negative, you were wrong, there was an error, and you in fact experienced positive. So reward prediction error is something that we can experience by wearing something as simple and as light and as convenient and as comfortable as a brace that does all of the rest of those opposites. Stops your cycle of being fearful and watchful for pain, stops your cycle of being fearful and watchful for imbalance, stops the same with regard to strength and activity and all those negative external stereotypes you hear about stand up straighter, stand up straighter. You stop all of that cackling as well. It's extremely powerful. So we love to use the four-letter word of hope to beat those other two four-letter words that we won't mention again.
Well, you're speaking my language completely, and I couldn't agree with you more. And it's just, I'm sure a lot of people listening are thinking it's very hard to think how a brace, because we have misconceptions about what bracing is, that it could actually give you freedom and reduce your fear and all the wonderful things that you talked about. So Ed, let's turn to you now. So let's discuss, while the Spinomed has been on the market for a while, this is the brace that we're talking about, people really don't know much about it and exactly what it does. So, here Mike has shared so many great things, but why don't you just give us a brief overview of the Spinomed and how it can accomplish these things, which a lot of people are thinking, wait, a brace can do that? So why don't you shed some light on this?
Yeah, sure. Thanks so much, Marty. I really appreciate the question, and thanks, Mike, for leading us down this path to discuss this. So, yeah, Spinomed is it has been on the market 25 years now, and since 2003 in the United States alone. And so it is a very effective tool that has been I don't know, kind of hidden in the corners some ways you could think about it. And the Spinomed kind of gets to that strengthening, stability, quality of life goal that Mike was mentioning, trying to overcome fear and getting people up and around and moving that have kind of pulled back a bit. Maybe they've had a fracture, maybe they've felt unstable. And the role and the goal of the Spinomed really is to help a user or patient um, really kind of regain a higher quality of life, something that they were used to. Maybe it's as simple as taking the dog for a walk or going for a walk with their grandkids or something along those lines. Things that they used to really enjoy, but now they're a little worried about because, they've got this oftentimes a diagnosis of osteoporosis. They feel like they're a little bit more unstable because they're in poor posture. Maybe somebody's noticed that they're in poor posture, but it's difficult for them to get to a better posture on their own. Maybe they continually forget it, or it's difficult. As a therapist, it's a challenging thing to train. And so the Spinomed is has been created to use the brace as a stability item, but one that trains core musculature, reestablishes a position that the patient can get to on their own, and then over time will strengthen the core, reduce that hyperkyphosis, or better term, forward-leaning posture, maybe for some of the people listening to this podcast, and bring them back to a better position that they feel a little bit more stable. So that's a good idea of what the Spinomet is all about.
And is there any science behind this that when they created the Spinomed?
Yeah, sure. Thanks so much for that question. Actually, it is still the only um, dynamic TLSO in its segment, which is really osteoporosis and treatment of vertebral compression fractures related to osteoporosis and the like. It's the only product out there in its segment that actually has evidence-based, peer-reviewed, and published studies. And the one I'll refer to the most throughout this conversation was done in 2003, published in the American Journal of Physical Medicine and Rehabilitation. And it became pretty much the gold standard as far as what a dynamic or a training orthoses can actually achieve. Up until that time, most orthoses really, and it's still oftentimes thought this way, which is one of the challenges that we have to overcome, in that bracing immobilizes, thereby weakens the musculature that of the area that is trying to support. And so you've got all this training that you need to do afterwards. A person comes out of a brace or a cast weaker than they go into it. The Spinomed kind of turns all of that on its head and is demonstrated by using this particular type of orthoses. You can, over time, become much stronger. And so the science has indicated just a couple hours a day while you're wearing the Spinomed over the course of about 6 months, you can see a 73% increase in back extensor strength. That's significant when you're talking about the patient population that we're dealing with here. And not only that, a 11% reduction in angle of kyphosis. In other words, pulling the patient back up to a better position for stability. And on top of all that, a 38% reduction in pain, right? And those are pretty important numbers. There were a number of other things that we discussed or that we looked at for that study, but those are the ones that really kind of resonate with the people that need to use it, as well as the physicians and the PTs and those that are prescribing and fitting in helping these patients.
Wow. It's, it really indicates how much it can help someone who has osteoporosis or even, kyphosis, so many different areas. It can really make such a big difference. And I think what you said, because it is counterintuitive, most people are listening thinking, oh, I've been in a cast or a brace and I've gotten weaker, just exactly what you said. So it's wonderful that the research shows that just the opposite, that here you can correct your posture and then become more active and everything actually improves. So to me, it's just such a win-win. So let's just go into specifics. So let's say someone is going to use, you want to just talk about who are the candidates for this? Who really,
Sure.
yeah, who you
Sure,
recommend?
we can start there.
Yeah.
That's no problem at all. Yes, so patient selection is important, just like it is for almost everything that you do, right? And so what we're looking for when we're looking for the ideal or close to ideal person that's going to use a Spinomed, number one, they have to be able to be active in it, and when I say active, I don't mean exercise, I mean just be able to be up and around and moving and not sitting. The Spinomed is not an effective tool for somebody that is gonna be in a wheelchair or, gonna stick to a recliner or things like that's just not it's not effective in that arena. It needs to be used by a person that is gonna go take a walk, maybe work around the house, those types of things, up and around active. That's what we mean by active. Also, they need to be able to put on a jacket. If they can put on a jacket, they can put on a Spider-Man. Simple as that. So it's as easy as putting on a jacket or a backpack. We often people relate it to a backpack because it kind of fits like one, but it's very simple to put on. And you take it off the rack and put it on and be on your way in under a minute. So it's pretty simple to understand. So that's really important. We do have patients that use it that need assistive walking devices like a walker, things like that. But that's the extreme for sure. The majority of the people that will be in the Spinomed are postmenopausal women, and most of those are going to be in that 60 to 70 age group. We have the Spinomeds on people as young as in their 20s, and then we have them in their 90s, right? So they're all over the place, but the majority of the people that end up in the Spinomed are in that postmenopausal woman's category of 60 to 70ish.
And how long do they wear it for? What's the typical, like, how does it work
It is.
in terms of time? How long are they in it? Are they in it all day? What's your recommendation?
Yeah, great question. This one we get a lot, right? Once they get past the idea, okay, this might be workable for me, but how long am I going to be in it? And so we really base our recommendations and protocol off of what was studied and published. So, and that the caveat always has to be employed that your care providers will make ultimate decisions on how often and when to use the product and that sort of thing. But as a general rule, we follow the guideline of 2 hours a day, an hour in the early part of the day, an hour in the later part of the day, while a person can be up and around and active. And also, the caveat there has to be that this is a training device, right? So yes, it is stability. Yes, it is a brace, but it is also a training device, which means you're going to exercise your core musculature. So, a lot of the people that will get the Spinomed are going to be fairly deconditioned. And so an hour is going to be a stretch, right? So you may have to meter it in over time. So maybe the first couple sessions will be 10 minutes. And then you'll just gradually work your way up to that objective of an hour at a time, early in the day and late in the day. Um, our studies have shown that following that protocol, you're going to get the maximum effectiveness at about 6 months, and then you move more into a maintenance routine. But as mentioned, some people won't be able to use it an hour at a time to get started. They're going to have to bite off a little bit smaller chunk at a time.
And I guess it depends on the person, but the goal then, yes, depends on the severity, but the goal would be then to gain your own strength and be able to wean off of it for some people?
Yeah, Thank you so much for that follow-up question. Yeah, so the objective of the Spinomed is not to so should probably take a step back on the wearing, because really what we're talking about here is how the device actually works, and why it's effective in those shorter periods of time versus some of these other more traditional products that you would put somebody in all day long, right? And just that's what the way they live with it. So the Spinomed works off a process of biofeedback, and the way that works is that when whoever the person is that fits the product, they're going to shape it to your body on that day with you being able to get up to the position of best posture under your own power. So they're not going to push you up there. They're not going to hold you there and fit it. They're going to guide. You're going to get into that position, and that's how they're going to shape it. That's an exercise belt just for you to get to that position because you're not normally there, right? And so we're going to fit it at that position, and then every time you put it on, you're going to constantly be cued to be in that position. The straps and the posterior panel of the Spinomed work in unison so that no matter how the patient is moving, it's reminding them to use proper posture, their best proper posture as measured on that particular day. When they come back in maybe a month to 6 weeks later for a follow-up, they're going to be very easily into that position, and you're going to ask them, or the provider's going to ask them, okay, let's see how much better you can do now. Let's see how close you can get to a better postural position. You're going to notice that they're able to get further, and we're going to readjust the product. And that's how we get the patient back from a poor posture to a significantly improved posture over time and a stronger core because it's constantly reminding the person to use their own musculature to get into that position. It's not holding them there. It's guiding them there and cueing them. So that's why some of the deconditioned patients will have to bite out smaller bites or chunks at the beginning because it is exercising them every day, a couple times a day, and you don't want to overdo it and have to start all over again.
Hey, Margie here. High quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store. And in there, you'll see my favorite bone building supplements. So make sure to check it out. And the link will also be in the show notes. So let's get back to the show. My experience with the Spinomed when I was working in the hospital and just, with acute orthopedics and different things has always been with compression fractures. That was the brace that the physical therapists all recommended and it was so effective. And do you want to explain how it's used and really can make a huge difference in vertebral compression fractures? Because oftentimes I get this question from the community all the time. First of all, many people don't even know they have a compression fracture, but when they find out, oftentimes they're not even put in a brace or they don't, they're much more restrictive braces. And so I think, anyone who has spinal compression fractures, this brace is just so far and beyond others. Do you want to just share, how it is used for compression fractures? Because it's so effective. That's what I've seen. That's been my experience.
Sure. Thanks so much for that question. And it is oftentimes used for compression fractures. As a matter of fact, in the studies or at least the study that I've cited and others that are out there, the participants in the study actually had to have vertebral compression fractures to be included in the study, at least one. And in the gold standard study that I referenced already, the average was 2.1 per patient. So, these are fairly, it's pretty much what you see when you're working with a patient that's been referred to physical therapy for postural alignment training, stability training, that sort of thing. They're going to have some of those types of conditions, right? And on top of that, also with vertebral compression fractures, pretty much they always are in a hyperkyphotic or that forward leaning position because that's a chicken and egg thing, right? Which one, which one came first? But you get that wedge fracture because you get that pressure on the anterior edge of the vertebrae, and so that's really where the Spinomed comes in. So also in those studies, the average angle of kyphosis for those studies was 60 degrees, or the minimal angle. I'm sorry, not average, the minimal angle. So that's what you see in the clinic, right?
We're gonna
And
show a picture in a minute because it's quite amazing. But before we do a picture, people are listening, how would someone go about getting a Spinomed? It's not like you order it on Amazon. I mean, explain to us, how someone can get a Spinomed.
yeah, so to get to lock in with the vertebral compression fractures. So and how do you get a Spinomed? They kind of go in unison, right? So acute but stable vertebral compression fractures, silent but out there for a while. Vertebral compression fractures, they all fall under the Spinomed's role, and it's often going to follow with the prescriptions, right? So the Spinomed is provided by prescription, and that's important because even if you were to get the Spinomed elsewhere, you need to have a prescription to actually have it go through insurance, which is going to be, one of the things I'm sure we'll talk about. But so it's going to come from a prescription from either a primary care provider, your orthopedist, whoever, somebody in your team that's the physician that's working with you on this challenge. And oftentimes we'll find that that's going to be instigated by the physical therapist that's working with the patient, right? And so the therapist is working on postural alignment procedures and exercises you can do, but the Spinum is a great adjunct to that, right? So it's a constant daily reminder where you're seeing the therapist, a few times a week maybe, but the Spinomed is with you all the time, and it's reminding you of the position you're supposed to be in. So the script really has to come from the doctor. Um, it gets to the patient through a provider that has been trained, that's a professional, um, and that could be in the physical therapy clinic. It can come through the doctor's office sometimes. Oftentimes, most often, it comes from orthotists that are trained to fit these types of products. So, people that provide DME products in the bracing world, that's really where you obtain a Spinomed.
Okay, so we're gonna show a picture because I think a picture is worth 1,000 words. But before I do that, so what you're saying is that typically this will be covered by someone's insurance?
Yeah, so it's been covered close to 2 decades now under Medicare coverage. That's you end up with L codes. But I don't want to get too far into the weeds, but L
Uh-huh.
codes are tied to products to help you get products paid for through Medicare or private insurance payers. And the requirement for them is that they are medically prescribed and necessary for your particular situation.
No, I think that's important. That's one of the reasons also this is something that's covered by insurance, and most people don't even know it's an option. Okay, so I'm excited to share this picture. As I said, a picture shows 1,000 words, and when I show it, why don't you just explain it to everybody? Okay, so here we have this picture, and just explain this to us because we see the person's head. It's not where the black is. I mean, this is quite amazing. So whoever wants to start just talking about
Go
this
ahead, Ed, you start.
Yeah, sure. Thanks, Margie. I love this photo. Betsy Newcomb. This is provided to us from Betsy Newcomb in her clinic, and yeah, I think it's just fantastic because it demonstrates, some of the extreme, right? This is not your average, right? This is going to be the more challenging cases. An older gentleman that is obviously need of a walker for sure, to help balance himself. But, on March 15th, his best posture is he's still looking straight at the ground. right? And he's not looking really where he's walking. He's not enjoying everything around him, right? Because he's just looking at his feet. But if you look, just 6 weeks later, that middle photo, I mean, he's much more upright in a much better position. He can see forward, and you can clearly see that he's going to be more stable in that position. And then finally, by the time he gets out there to June 13th, so about 8 weeks, 9 weeks down the road, right? Boy, he's looking forward, and his quality of life is going up dramatically. He's more stable. Of course, he's going to still be using his roller walker, but his quality of life is just going way up. And I like to think that he's smiling in that photo. We can't see what he's doing, but I gotta believe that he's pretty happy with where he's going. This is the extreme. Most of the time, we're not anywhere near this, right? We're at a much more manageable, much different, type of situation, but it does provide a really dramatic image, right? Picture worth 1,000 words, as you said, right, of what is achievable with the Spinomed.
Truthfully, I mean, all of us have seen people or may know people. So if you're listening and you know someone like this, make sure you share this recording because there's hope. A lot of times you just feel so sorry for this person because we know how devastating this position is and to live life like this. There's just such a difference, and it's not even that long from March to June. It's really quite amazing. So, Mike,
Yeah.
you have to say about this.
Well, there's 2 things, and I think they'll be very, intriguing for your audience and for your listeners to understand both of these. The first one is something we call tissue hygiene, right? So you have to prepare any tissue, muscle, bone, tendon, in order that it can become its full and best self. So with tissue hygiene, we understand it can go positive and negative. So for this gentleman here on March 15th, he's actually building up the endurance in his back muscles. He's building up the stress that is good stress in his vertebrae that aren't used to being aligned up into this more optimized alignment. And he's also building up the strength to hold himself up there for his one-time best pose, etc. So tissue hygiene is something that Ed has spoken to eloquently so far in our podcast, where we try to introduce a wearing schedule so that an individual can become acclimated. Bones, tendons, muscles, the musculoskeletal system can change over time. Here's the most compelling thing that I want to say about this, and Ed hinted at this, and this should be something that's very attractive for your listeners, and that's gamification. Some of us are familiar with the concept of gamification, but it's born out here. Ed spoke about 15 minutes ago about having a person come back with the Spinomed, readjusting it, and seeing that we need to actually increase the positioning of the Spinomed because now this is too easy for you. So we've had to change it by 6 degrees, 10 degrees, or 11 degrees. Those are numbers that resonate with real people, and it's called gamification because we have a tendency as human beings to track numbers and determine whether or not we're getting better based on numbers. So when Google app tells you you're going to make it some place at 7:57 and you make it there early at 7:55, we feel elated because we beat the number, we beat the prediction. And when the doctor tells us our blood pressure is going down in the correct way, or our hemoglobin A1C score, this is all gamification. And this is something that the experience of the Spinomed brings to people because they can actually see and hear numbers that tell them in a reinforced manner, you're getting better.
Oh, I love that. And I just I just the quality of life, what a difference into, as a physical therapist, both you and I, Mike, I look at this, and I cringe and I just know what's going on in all the tissues. And there's just such a sigh of relief with pain. And anyone with osteoporosis, I know what's happening to that vertebrae. So this is just, I
Yeah.
just think it's such a wonderful device that can do this. Is there anything more we want from the picture or should we move on?
There's one last thing we should state here just to be equitable across it. So, Margie, you and I both collectively have something in the neighborhood of 65 or 70 years of physical therapy experience, we should also recognize that this photo was taken by an occupational therapist and that people that have the ability to access physical, occupational therapy, physiatry, many other health professionals can help them become introduced to a Spinomed.
No, that's so true. Whenever I would, because I work with people really all over the world, but people will always ask me, and, "Oh, their doctor prescribed this brace," and I look at it, and it doesn't at all have the flexibility. There's just so many things it's lacking. To me, it's not even close to giving the flexibility to continue to improve. But what I've found is there's not the awareness. That was one of the reasons I asked both of you to come on the podcast, because I don't think people realize that this brace is available and all the potential positive things, and it's covered by insurance. I mean, it's just such a win-win. Like, this man's life is so dramatically changed from this brace, and as you said, this is the extreme, but it can help in so many situations. So, anything else, or should I shut this should we move on?
Good.
Okay, I'm just gonna stop sharing. And, okay, Mike, so I have a question for you then. We just saw the pictures, and Ed explained how the spinal mid brace can help support improved alignment of the spine. But you're an expert, and you're an expert in many things, but also in the brain. And you've been a practitioner for over 35 years. So tell us a little bit about, you've written a book on the brain, and the brain controls so many different things, as we all know. But tell us, what benefits also this can help with the brain when people are more aligned.
Absolutely. So, Margie, I would say one of the first things that we have to think about when an individual feels more well aligned, if we're talking specifically about the brain, we have to understand that the experience of stress removed helps the brain to continue to perform at its optimal capacities, right? So, when we're under a degree of stress that we haven't chosen, our brain can't function with memory, with reaction speed, and with joy in the fashion that we would normally be able to. So that's one thing, is your cognitive functions are routinely suppressed by pain. So I could list about 17 different brain structures that are suppressed when a person's in persistent pain. So that's one thing. The second thing we'll say is that when an individual is separated from or not able to engage in the activities that they prefer, pushing grandchildren in a stroller, tending to their garden, walking their dog, and so on. We also know that the individual is not experiencing that rush of dopamine on a regular basis. And in fact, they're getting less of that nucleus accumbens, that area of joy, if you will, if there's a center of the brain, is not getting lit up. And so that suppresses the brain and causes it more likely for us to also feel depressed. The third thing that happens is when an individual is feeling as though they have the ability to be able to improve, and they see themselves at 81 years old, and I thought I was going to get nothing but worse, but they see themselves as improving, we also get serotonin and we get dopamine in a rush. So that is decreasing my depression, increasing my physical activity, my mental outlook, and therefore I will become more participative in other things that I want to do, feel more productive, etc. So basically, you're taking away depression, you're restoring joy, and you're removing all of that suppressive tendency on the brain to feel the negativity, stress, and pressure. Now, that's just the brain. I won't belabor it. As you and I have talked about this, Margie, I've written a book on the brain and body interconnecting, because we could go on, and it may surprise your listeners to know that persistent pain will increase your body's inflammation, will increase your body's cortisol, will increase your body's blood sugar instability, so your hemoglobin A1C or your blood sugar scores. And we could go on and on about the detrimental effects of being fearful, persistently in pain, or feeling these negative stereotypes of what is going to happen to me as I age. We're removing all of that. So there's a lot to be said there. Thanks for the opportunity to answer a part of that.
Yeah, in this population, most of the people who are listening are so concerned about their bones and they're familiar with the osteoclast breaking down the bones. So all these things you just talked about, the fear, all of this is also just, it's actually breaking down bones. So if we can stop that, we're doing such a service. So
Yeah.
for people listening and they're hearing about this, at what stage, because everybody knows posture is so important. And I've talked about this so much on the podcast, how critical posture is for everybody. And, when we are out of alignment, even a small amount, it's going to, create changes and we're not going to be as effective in our exercise and just have many negative effects. But at what point would you say, instead of what have you seen in your practice, Mike? At what point would you say this person could really benefit? I'm just trying to see who listening, at what point would they benefit from this brace?
So the number one and most simple and succinct answer would be when an individual is not able to conduct or participate in something that they would normally find joy in. So it doesn't matter whether that's pickleball or gardening or being a grandparent or taking care of their dogs. When something related to your spine is a barrier that's keeping you from participating, that's when you want to try to investigate to see if you can grab that something back with a very simple application of the brace for even a short period of your day. So we go to something that Margie, you and I know as the International Classification of Functioning, the ICF. And we go all the way to the end and we see what roles and responsibilities or activities and actions does a person have, and when they're missing something and the spine is the root cause of that, we try to correct that by eliminating that barrier.
So, Mike, let's just put it all in perspective in terms of where we're going to use this brace. So someone comes in, you see a patient, and they have significant kyphosis. They may or may not have compression fracture or even know about a compression fracture, but there's real limitations in their posture. So, where do you use the brace? Like at what point, or how is it part of the comprehensive treatment?
So we'll always analyze what is the individual's best uncorrected posture. We'll get a measurement of that uncorrected posture. We'll also want to find out what their resources are. And by resources, Margie, I mean what is their muscular endurance? How long can they hold their best posture? So that we understand, are we looking at this being a hard stop, something that we could train them into? Should we benefit by giving them some strengthening exercises so that their muscles are stronger? Or, which is often confused, some muscular endurance exercises so they can hold a posture better. So when we know the actual science, here's how far the person can achieve from a flexibility standpoint. Here's exactly what their strength is, and here's what their muscular endurance is. Now we have the opportunity to be what we know as personalized medicine or precision medicine, very precise about the prescription. Because I would never want to just give the same exercises to everybody for everything. So it's a very comprehensive but very easy equation to create. So when I say comprehensive, it means it includes everything. It doesn't mean that it takes you 6 hours to analyze it. So when we do that, we know that the Spinomed then provides that support, tissue hygiene, again, giving you a wearing schedule, putting you into a less painful position for a greater period of the day. Then we gradually increase that. We gradually increase your strength exercises if your testing demonstrates you needed strength, and we gradually increase your endurance exercises if in fact testing indicates you needed that. So we see that the Spinomed provides the flexibility and the tissue hygiene, and then we provide resources in strength or endurance.
Oh, I love that, and that's sort of what I believe. It's not, you know, you don't there's not a quick fix to anything, but when we do the comprehensive approach, that's when the magic happens, and that's when people's lives are really changed. So, Ed, just fill us in on someone's interested. We talked about they have to get a prescription from their doctor, and you want the physical therapist who has experience with this, right? It's not just going to anyone. You want someone that has experience with this and, has worked with. Am I right, Ed, about that?
Yeah, you definitely want it can be a therapist, it can be the orthotist that's gonna provide it ultimately. It's part of a team, right? We're all working toward the same goal, and, just making sure that the person that is ultimately providing the brace to the patient understands how to properly fit the brace and then coach the patient through using the brace properly. That's really critical. When you've obtained the prescription that says Spinomed, it's important that the script has that on there. That the patient goes through the process of obtaining a pre-authorization so they know exactly what's going to come out of pocket. Maybe nothing, maybe they have co-insurance, those types of things. But they always want, and especially in today's world, you want to know what's coming out of your pocket and whether it's going to be a deductible, copay, whatever. So that's important. Just make sure you go through that process and if you're working with somebody that is very familiar with the product and understands how it works, they'll guide you through that entire process.
Okay, great. So to wrap up things, where can people find the best where information? What's the best place for people who, yes, this sounds interesting, or my parent looks just like that man. Wow, this is an amazing thing I had no idea about. What are their next steps? Like where's the best place for them to, besides the physician, if they want more information, what's the best website for them?
Yeah, so, wow, there's lots of stuff out there on the Spinomed because we've been at it for quite some time. You can go to copahealthcare.us, or you can also go to the Spinomed page on medausa.com. Just click on the Spinomed page. Both of those will share very similar information. And with the Spinomed, you can also ask, there's a referral question on the Copa Healthcare website. You can, for more information, just click that button and just fill out a question and send it our way, and we'll get back to you on it for sure. And there is well, that's probably the best way. And then on YouTube, if you just type in a YouTube search bar, um, you can just type in Spinomed, and boy, you're gonna get lots of populations. There's lots of videos out there, but both the Copa Healthcare site and the MediUSA site, they both, have great videos on people fitting the Spinomed as well as how to use it properly on a daily basis, but there's lots out there.
Oh, well, thank you so much, Mike. Is there any last minute things before we end? This has been so informative. And my goal is to share things that can change lives. And I really do, I'm a big believer. I've seen the Spinomed in action, and there's just many, many people that it's just been, it's just been so helpful. And, again, I just like to get the word out because it's not something, oh yeah, everybody, knows about this. But Mike, is there any last minute things you want to share before we end?
Margie, you've done a wonderful job proctoring this and hosting us. I have nothing further to add, just my thanks.
Oh, and thank you. And I'll also put your book, I'll put that in the show notes too, because anything that can increase our happiness and joy and affect our brain is such a win-win for everything. Well, thank you both so much for being here. It's been a pleasure. And yeah, I can't wait to hear from what happens. That's always the best part of the podcast, is that when you get a note saying, "Oh, thank you so much for that episode," whether it helped them or whether it helped a parent or whether it helped someone that they found information that they didn't know. So thank you both for being here and taking the time. And I'll look forward to staying in touch with both of you. I hope you enjoyed my interview with Mike and Ed as much as I did, and now have a better understanding of active bracing and the Spinomed, and how this can be so helpful for many people as part of a comprehensive program. All the links to the Spinomed to learn more will be in the show notes. So thank you so much for tuning in. And if you enjoyed this episode, please subscribe. It's a great way to let others know about the podcast and spread this information. And I look forward to seeing you on the next episode.